Okay, good afternoon, everybody. Thank you so much for coming on this beautiful November day. I really appreciate it. My name is Julie Freilich. I live here in New Gloucester, and I am one of the, founding members of what we call BLING, which stands for Building Livability in New Gloucester, which is a volunteer group to try to promote an age-friendly community in New Gloucester. And as part of that, recently we were able to get some funds to be part of a pilot program called Grey New Gloucester Community Connectors. And we're able to have two volunteers who are Lori Fowler, Lori can wave her hand, and Cindy Slocum, who are our community connectors. And they are resources people in our communities to help those who are looking for services or helping to understand programs or just want information. And we're working very closely also with the Southern Maine Agency on Aging, who has what's called a community ambassador. So a lot of names, a lot of connections, but basically as part of this program, we're offering a couple of seminars and sessions so people can become more informed about some of the services at the Southern Maine Area Agency on Aging. And it seemed very timely that one of the first ones could be on the Medicare program and the Medicare options, given that it's open enrollment period, and we all know how confusing that is. So we're very excited to have with us today John Holland, who is a certified Medicare options counselor, to give us some overviews of the Medicare program in general and different options that are available to folks. So I'm going to let John talk, and I think he's going to talk, but also engage in questions as we go along. So thank you very much for coming.
So thank you, Julie. As she said, my name is John Holland, and I'm with the Southern Maine Agency on Aging. We're a nonprofit organization, and we have a lot of programs. I'm going to run through some of them quickly here for you. My role at the Southern Maine Agency, as Julie mentioned, is as a SHIP counselor. So SHIP stands for State Health Insurance Assistance Program. So we're all volunteers. We don't get paid. And our role is to present folks with Medicare options so that they can begin to think about what's a good plan for them. What works best for them. We don't sell any products. We don't get any commissions. We're completely unbiased. And again, as I said, our whole purpose is to give you information so you can make an informed decision. As I mentioned, we are a nonprofit organization. We do get a grant from the federal government through what's called the Older Americans Act. But a large part of our funding comes from donations. So again, our services, just to be clear, are totally free of charge, but we do accept donations if folks are so inclined. The other piece that just sort of the process that I like to go through as we go through this is, and we cover topics, if you have a question, just raise your hand or shout it out. I suspect if you have a question, probably some others do that maybe they didn't think of it or didn't want to ask. So it's always helpful to have the session be very interactive. The piece that I like to start off with is, again, just a little bit of an introduction of who we are. As Julie mentioned, the whole purpose of all the connectedness of these different organizations is to make folks aware of all the services that are available, all the programs that are available. So I'll sort of test with a group. We're here till as long as 2:30, but if we want to take a break, we can. I just want to point out, I brought some brochures, and they're on the table there, so feel free to take one. It gives a little more in-depth explanation of the programs. But just quickly, so on that first column is called Resource and Information. That's one of our more popular programs. And what that is we have a staff of social workers, paraprofessionals, And again, on the back of any of these brochures is all of our contact information, but you can call us at any time and just ask to speak to a resource specialist. And they're so well versed in so many different programs, all of these, by the way, and have just a great access to a lot of resources that even if they can't help you, they can make referrals. So feel free to contact them at any point. We also have our family caregiver program, so we're just seeing more and more where people are becoming caregivers. And so if anyone has done that or knows someone that's doing it, can be pretty intense. And so this is a program that kind of connects caregivers and gives them some guidance and and peer review. Money Minders helps folks with paying bills. Community cafes, I've got some information over there. These are local restaurants and cafes around town that offer a discounted meal through our agency. Meals on Wheels, I think everyone has heard of that. So that's us in Cumberland and York County. We're the Meals on Wheels. Of course, Medicare counseling, and then there's some more here. I won't go through all of them, but just to kind of give you a quick picture of some of the things that we're involved in. And again, help yourself to those brochures. Before I get started, can we see, Kyle, it's not working now, so. That's right. So before we actually get into the Medicare, can I just find out, maybe just by raising your hand, who's on Medicare right now? Okay. So then we have some that are on it and some that are coming up on it. And when I was putting this presentation together, I wasn't quite sure what the mix would be. So I'm going to cover some topics that would relate to folks that are new to the program, but then also for those of you that are in it, talk about what some of the changes are coming up for 2025. I always like to start off with, for those that are not on it yet, probably the ones that are on it already know this, but I talk about Medicare myths, right? So a lot of people aging into the system think that Medicare is free. Well, it's not. And so you'll see as this goes on that there are costs associated with Medicare. Another one is that Medicare covers everything. And it doesn't. Medicare is very specific about what it covers and what it doesn't cover. So we're going to talk about those things. And the other piece is Medicare covers prescription drugs. And the answer is sometimes. So there are certain situations where it does and some where it does not. I also like to talk about the two ways of getting Medicare. So a lot of people aren't aware of that, but there's two ways. There's what we call original Medicare or traditional Medicare, which you see in the bubble there. And that has a lot of different parts. And then there's Medicare Advantage. So what I'm going to do is just kind of walk through each one, and I'll hit on what each of the parts are in original Medicare. And again, if you have any questions as we go through it, just stop me. And then when we're done there, we'll switch gears and go to the Medicare Advantage. Sound okay? So Medicare Part A, I'm going to go through some of these pretty quickly, is the hospital insurance. And by hospital insurance, we mean inpatient. So many procedures these days with Medicare are being handled in a hospital setting. And in some cases, you might even stay overnight as long as you're not there for 24 hours. You might go in at 10 o'clock this morning. As long as you're out by 10 the next morning, it's considered outpatient. So it's important to understand that Medicare Part A covers inpatient, and there's co-pays with that. So here's one of the examples where we talk about costs that you're going to incur. Skilled nursing, and home health care. What those two are is if you've been in the hospital, you've been discharged, but either in the case of the skilled nursing, not quite ready to go home, so you may need some additional care, or you are ready to go home but need some part-time nursing, occupational therapy, that type of thing. not housekeeping or any of that. It's all medically necessary. Hospice care, I think everyone's familiar with that, and then blood. Nope. Oh, there it is. So here's where some of the costs come in. And you'll see as I go through this, I've highlighted some of them. And I'll tell you that where we are right now here in November, I obviously know what the costs were for this year, for 2024. Medicare has not released the costs for 2025 yet. And typically, historically, they've always gone up. So I've put these placeholders in for myself, and when those get released, I'll fill those in. So unfortunately, I'm not able to tell you what it is now, but this will give you a good idea of looking at 2024. So for most people, Part A has been paid for through your working career. You know, you were paying those FICA taxes and all. Well, that was going towards paying for your Medicare. So when you are first signing up for Medicare, you need to go through Social Security. And the reason you go through Social Security is they want to verify that you have met what's called quarters, your 40 quarters of working. It's usually about 10 years that somebody's been working. So, but once you've gone through Social Security and you get on the path of Medicare, then from that point on, you'll work directly with Medicare. But they're going to make sure that you've achieved those 40 quarters for premium-free Medicare. For those that didn't meet it, there's a cost associated with that. And they would explain that in Social Security. Every hospital stay has a benefit period. And again, here's another example of deductibles. So for let's say you go in the hospital in January, inpatient, you'll incur for this year $1,632 deductible. I think everyone understands a deductible. That's something you pay out of pocket before the plan kicks in. So that's an important question, I think, for everyone to understand. And this is where the terminology maybe can get a little confusing. So the $1,632 is a deductible. Right. The zero copay or 408 copay is a copay. So you have deductibles, copays, coinsurance is another term you're going to be hearing pretty soon. So a copay is a flat amount. A coinsurance is a percentage of whatever that charge is. So that's a good clarification, yeah. But so let's just continue your example. Let's say you go in the hospital in January, you're inpatient, you pay the $1,632. Let's just say you go in again in June of the same year, you'd pay another $1,632.
Oh, each time?
Each, what's called benefit period. And the benefit period is 60 days. For original Medicare, there is no maximum. It could just keep going and going and going. Skilled nursing, similar situation, a zero copay for the first 20 days. There's no deductible there. I'm going to switch to this. So that was Part A, which is inpatient hospital. And essentially, Part B is everything else, right? It's doctor visits, labs, outpatient. You can see this list is pretty comprehensive. There may be a few others. But here's the key piece. Medicare is going to pay 80% of these. You're on the hook for 20%. Now, with the Affordable Care Act, which came into effect a couple years ago, Medicare now covers preventative services for no copay, no deductible. That wasn't always the case. And we all know that, what's that adage, an ounce of prevention is better than a pound of cure. So finally Medicare caught up with this idea. It's less expensive to keep people healthy. And so that's how this sort of came about. Now for Medicare Part B, remember the Part A for most people, there was no premium. For Part B, this year, it's $174.70 a month. And historically, it goes up every year. This one is tied to inflation. So or cost of living. So it could go up or down. There were a few years there when the cost of living was flat, and it stayed flat. Part B is, and you'll hear this term, means tested. So some of the programs in Medicare are means tested, meaning they're going to look at income, right? And so for folks that have incomes, if you're single, and again, this was for 2024, $103,000, or double that amount if it's a couple, will get what's called IRMA, an income-related monthly adjustment amount. So it's a surcharge on top of that $174 for high-income earners. There is a deductible for original Medicare. Remember, we're still in that first column, original Medicare. For this year was $240. And again, this idea that you'll pay 20%, Medicare typically pays 80% of covered services. And then financial aid, both the state of Maine and the federal government offer different programs for folks that are in that lower income bracket. And that's another feature of what we do. So not only is my role as a SHIP counselor to be out in the community doing education and these types of things, but we also do what we call one-on-one counseling. So again, you can call the agency at any point and schedule an appointment. And we're doing appointments now. We're doing a lot more now in person. We stopped for a while, of course, during the COVID. We do quite a few online. So we do Zoom appointments too, if that's an easier piece for folks. So it's in those one-on-one sessions that we would start to discuss, you know, income and you know, is this a program that might fit for you? So you saw with original Medicare, we're still on that there's co-pays, co-insurances, right? Deductibles. There's this piece in the middle called supplement plans, or Medigap plans, as it's sometimes called, that depending on which plan you choose, will pick up some or all of those additional costs that Medicare doesn't cover. And again, it's important to understand that this plan, as well as Medicare, is only going to cover what's considered medically necessary or is deemed by Medicare. So an example of that is acupuncture, right? So with acupuncture, Medicare is very specific about covering acupuncture for lower back issues. And your doctor would have to do a good job of describing that. But if you went and got acupuncture for your shoulder, Medicare is not going to pay for that, so you're on the hook for the whole thing. And the supplement plan is not going to cover that. So it's important to understand what Medicare covers and what it doesn't cover. And you can go online and you can see services that are covered. Just a couple things. These plans, they are sold by private companies. They do have to follow federal and state guidelines. So here in the state of Maine, they're governed by what's called the Maine Bureau of Insurance, and they're tightly controlled. They are, the Maine Bureau of Insurance are the ones that kind of keep a tight rein on these folks. They're the ones that approve pricing increases and so forth. They also handle complaints if you had complaints. I like to point out that these are standardized plans, and so this is an example where for supplement plans where it's a good idea to price shop, because a plan G, for example, which happens to be a pretty good plan, is a plan G, is a plan G, is a plan G. So no matter which company you go to, and you'll see in a brochure that I can provide to the folks here, and they can get it to you a little bit later, or you can go online and get it at the Maine Bureau of Insurance. But you'll see that a lot of these companies, I think there's probably 10 or 15, maybe more, that carry these private plans. They're all different prices. So, but if you're getting a plan G, it's all going to cover the same kinds of things. a lot of people choose different companies for different reasons. Maybe they've had a good experience with, you know, a particular company, and they like their service. I've actually had some people say, well, my brother-in-law, my sister-in-law is a broker, and they deal with these companies. So buyer beware, I guess, it would be my advice. You know, just make sure, and all these companies have, you know, quality ratings and reviews. But chances are, if they're in the program here in the state of Maine, they're going to be pretty reputable. The Maine Bureau of Insurance really does a good job of I'll say, and I mean this in a nice way, of keeping them reined in. So just to give you an example here, and again, the brochure will give you all the information you need to know about supplements here in Maine, but just sort of give you a picture of it. Remember we talked about deductibles, for example, for hospital, right? So a Plan G would cover, so that's remember that's $1,632, that's the deductible for this year. A Plan G would cover all of it. A Plan K would cover 50% of it, 75%, and so on and so forth. Now, obviously, the more benefits that they cover, the higher the price. So that's why you want to really kind of look around, shop around, and make sure you understand what it is that you're looking for. There are some plans, someone asked the question about out-of-pocket. There are some plans that are starting, again, we're still on original Medicare, that are starting to offer these out-of-pocket maximums. So again, the whole concept of insurance is spreading risk around, right? And so if as a beneficiary you're willing to accept an out-of-pocket limit of $7,000, or in this case here $3,500, then your premiums are going to be much lower than someone who's going to get paid for every expense. Does that make sense? Yes, sir.
It says foreign travel emergency. Could you explain what that's?
What is it again?
It says foreign travel.
Oh, foreign travel. Yes. Yeah, that's good. So Medicare is a program of the United States government, so it's going to cover you in the United States. If you go outside of the United States, with a few exceptions, Medicare is not going to cover that. Alternatively, though, they do cover, one of the nice things about these supplement plans, if you're within the United States, and let's say you move, you know, or you're traveling and you have an emergency, they're gonna cover that. So the last piece of that diagram, if you remember, for original Medicare, there was A and B, then there was the Medigap, and then there's prescription drugs. So traditional Medicare doesn't, but in and of itself, doesn't cover medications. That one exception was if you're in the hospital, inpatient, and this is where it gets a little goofy, but they'll pay for the medications that are treating the ailment with which you were admitted. But if you're taking like maintenance drugs, I don't know, for cholesterol, high blood, they're not gonna cover that. And the hospital, this is where it's goofy, the hospital won't let you bring your own medications in. So it's kind of a catch-22. And what they'll tell you is to submit the bill then for those maintenance drugs to your prescription drug plan. Be that as it may. So with prescription drug plans this year, and for those of you willing to stick around, I'm going to show you the Medicare Plan Finder afterwards, which will show you what all these plans cover and medications. But essentially, it's the premiums range anywhere from 50 cents, so that's not a typo, it really is 50 cents a month, on up to 121 plus. And again, there's that IRMA, the surcharge, is applied to that for folks that are in that higher income bracket. Deductibles for this year, CMS says that, CMS, by the way, is the Centers for Medicare and Medicaid. They're the ones that said this year it's $545 is the deductible. They have said for next year it's up to $590, meaning that's the maximum a company can charge. Some of them are a lot less than that. Then there's this open enrollment period, which we're in right now, October 15th to December 7th. We were talking about that a little bit earlier before the session started. It's important for folks that are on their Medicare, the Part D, or Medicare Advantage for that matter, to either review your coverage, and I'm going to show you how to do that on your own, or come and call us and come and see us and we'll review it. I actually was doing Medicare appointments this morning, and we had a couple come in and with one of the changes in the formulary for the husband, we're going to save him a little over $300 just by switching plans because his medications had changed. And then special enrollment, so this goes back to that question you'd asked. If you are coming onto Medicare after 65 and you had that employer plan, or you move out of the area, or you lose what's called creditable coverage, you'd be entitled to what's called a special enrollment. And then one of the other income plans, or low income, is that Medicare Savings Program. And again, those are the kinds of things that we would talk about in this one-on-one session. So the idea is give people the big picture through these education pieces, and then narrow down to your specific situation with a one-on-one. So that's all the original Medicare. What's Part A? Yep. What's Part B? Yep. Yep, basically everything else, yeah. And as we saw, there's costs associated with Medicare, so some people will choose to get that supplement plan, and then you get a prescription drug plan. It's important to note, if you don't, we actually will have some people come and say, well, I don't take any medications, I want to get on Medicare, so why do I need a drug plan? Well, the answer is you don't, but if you don't sign up for a drug plan when you were first eligible, down the road, let's say 2, 3 years, 4 years down the road, you do need a plan. You could pay a penalty for not signing up when you were first eligible. So if that's the case, where someone comes in and says, well, I don't take any medications, we'll probably recommend they go in that 50 cent a month plan, you know, that low cost plan, which then covers them. That's what's called creditable coverage. So that's traditional Medicare or original Medicare. This is Medicare Advantage. So I asked earlier, who's on Medicare? And a bunch of hands went up. Who's on a Medicare Advantage plan? Ah, okay. So we have a few people. The rest, I assume, are on original Medicare. Okay. So Medicare Advantage plans, it's still Medicare. So it covers all of the same things that original Medicare does. What a lot of people find attractive about Medicare Advantage plans, particularly as they age into the system in this day and age, is that it has the same kind of look and feel as an employer plan if they're coming from the workforce. So it combines all of the things we just talked about here into one plan. And so it includes the hospitalization, the medical, it is its own supplement plan. Some people may be able to get medications somewhere else. They don't always have to get a plan that has drug coverage, although most of them cover that. Some people, for example, might be able to get medications, say, through the VA or through a union or employer plan. But the highlighted area down here, you can't have both. So you've got to be one or the other. So that's the challenge of folks coming into the system, is trying to decide, am I going to go left or right? Am I going to go original Medicare or Medicare Advantage? So let's talk about Medicare Advantage. It's a substitute for original Medicare. It covers all the same things. You'll see this kind of alphabet soup here. They're either HMOs, Health Maintenance Organization, HMO POS, Point of Service. PFFS is what's called Private Fee for Service, or PPO, Private Provider Organization. And again, you can look up all those terms if you want. It's all there on Medicare.gov, or you can Google it. The takeaway is that they're all managed care plans, right? So what that means is They all have defined a network. And an HMO tends to be a very tight local network. The HMO POS is something come on the scene several years ago. It has HMO characteristics, but the POS allows you to go out of the network, but typically at a higher cost. Right? The A and B is managed by whatever company you choose, and you've heard of a lot of them: Anthem, Martins Point, United Healthcare, which is under the brand of AARP. So they're all out there. The D is usually covered in most of those plans. One of the things that a lot of folks find attractive about Medicare Advantage plans is because they'll cover additional or have additional benefits that you don't get through traditional Medicare, like dental, vision. Some of them are offering gym membership, or they'll give you this, what they call like a wellness card now, and you can go and buy over-the-counter drugs. So they're really offering a lot of benefits that you would not get with traditional Medicare. So vision, for example, these folks will give you the opportunity to get a vision exam once a year. It's just going to be basic, but they'll cover it, or a physical exam. Traditional Medicare does not cover vision, does not cover dental, does not cover physicals. They have what they call a wellness exam, which is a 10 or 15 minute discussion with your doctor about what your health care might look like for the next year. So it's important to understand those differences. Now the dental, vision, they're going to be probably basic, so you need to look into what they actually cover. But some of them are getting more generous. And then that emergency travel that we talked about earlier. So if you're traveling to Arizona, Florida, and you have an emergency, they're going to cover you there. The foreign emergency travel too, and again, there's some exceptions to that, so you want to just be sure you understand if you're going to be gone for quite a long time, to be sure that this is going to cover you. Costs vary. You'll find with some of the Medicare Advantage plans in the area that we cover, Cumberland and York County, you'll find that they have a zero additional premium. Everybody pays that Part B, right? But on top of that, you'll find some plans have no premium, some have a little bit more. And so folks are somewhat enamored with that idea of a low or no cost, and so they'll jump into that. But it's important to understand what the differences are. You have to weigh the total package, right? I don't know that you'd necessarily make a big decision like I want to go to Medicare Advantage just for dental, because you could obviously buy dental insurance if you have traditional Medicare. What's it? Delta Dental, Aspen Dental. So I wouldn't make the decision based on just that. I'd look at the whole picture. Now, if you do decide you want to go to Medicare Advantage, that's a nice benefit that you'd get that would go along with it. And the other thing is you need to make sure your dentist or your eye doctor is going to be in that network. So remember we talked about with traditional Medicare, it's $1,632. With a Medicare Advantage plan, they're all a little bit different. They could charge $350 a day. So it's hospitalization now. They could charge $350 a day for days 1 through 5. And you're on the hook for that. And then they're going to pay everything else. So it's important to understand the cost structure of the Medicare Advantage. Again, at first blush, people look at that and say, oh, it's a zero premium, but it's going to be more of a pay-as-you-go. Same list here, except the difference now is doctor visit. A lot of Medicare Advantage plans, if you stay within the network, you go to primary care, it'll be a zero premium. Some will charge a few dollars. A specialist might be $35. And you can read down the list there. These preventative services are the same as traditional Medicare. They're going to cover those. So what's the difference? Why would you choose one over the other? A lot of it just has to do with what your personal situation is. Do you use the healthcare system a lot? Are you generally pretty healthy? Do you eat right? Don't smoke? Exercise? All the things we know we're supposed to do, right? And what you want to weigh is either how much you're using the system or how much you anticipate you'll be using the system, because those supplement plans can get to be pretty expensive. They're going to be in the low to mid $200 a month on top of your $174, on top of your drug premium. So when you start to add it all together for traditional Medicare versus a Medicare Advantage, that's what you want to think about. So they're managed care plans, the Advantage plans are, meaning you got to stay in the network. You can sometimes go outside of the network, but you really should check to make sure you'll get covered. Typically, we already talked about this, they have vision, dental, low or no premiums. The cost structure, you're going to find co-pays, co-insurance. Remember, a copay is a flat amount, co-insurance is going to be a percentage. If you're on a Medicare Advantage plan and you are getting an MRI, which can be pretty expensive, and that's a co-insurance, that could be a pretty hefty price tag. And then deductibles. Some of them you might have to get, again, because they're managed care plans, they're going to sometimes ask for what's called prior authorization. All the Medicare Advantage plans have a max out of pocket, and again, that gets down to that notion of how much risk are you willing to take in return for the benefits that you're getting. So we talked about enrollment periods. I think this might add a little more information to the question that you had. There's a 7-month window that you have in which to enroll in Medicare, and there are no penalties. So it's 3 months before your birthday, the month of your birthday, and the month after. And you can enroll in any one of these plans during this time, and there'll be no enrollment penalty. Now again, the exceptions are, so this is that special enrollment, and this kind of fits the example I think that you mentioned for your wife. So for folks that are working and are in an employer plan and have what's called creditable coverage, they can wait until they're ready to retire at 67, 68, 69, whatever, and you want to sign up. Probably 3 months is a good time. There's some other enrollment periods. This is that initial enrollment, so that's for someone just coming into the system. You're just turning 65. Again, you want to do that 3 months before you would sign up through Social Security, either in person, you can make an appointment in person, or online if you set up a Social Security account. I mentioned that that depending on your income, there are some programs available, and this is one of them. It's MSP, which stands for Medicare Savings Program, and it's federally funded at the federal level, but it's administered at the state level. I guess just suffice to say it's people with limited income, and we would do that screening in one of these one-on-ones. It can be a very generous program for folks that qualify in terms of some of the costs that we talked about. Deductibles, co-pays for health insurance is one of the programs is QMB, Qualified Medicare Beneficiary, or QI, Qualified Individual. So it could cover that, or even if it just, depending on your income, if it's a little bit higher, maybe we'll just cover all the prescription drug costs. And again, here's our number here. I would suggest that, if you have any questions after this, or you think you want to set up an appointment, yeah, that's the number to call. Now, What's new in 2025? So a lot of nice things are happening in 2025. I've been doing, this is my 12th year doing Medicare counseling, and so these are some of the more exciting ones. A $2,000 cap on out-of-pocket costs for prescription drug. I'll tell you, for some people, that is a windfall. That is just wonderful. We have some people that we see that are taking very expensive medications, and by February or March, they're already over the $2,000. So this is going to be great for them. There's a $35 cap on insulin that actually started last year. Yeah, they've changed. The donut hole's gone away for any of you that may have heard about that or heard the horror stories of it. Yes, it sort of replaces that, I guess, just to, yeah. So that'd be the short answer. Again, if you want to stick around and I'll show you how to get online, I can show you what those, there's still 3 phases, so, but not the donut hole. Well, it's just, it was called the coverage gap and then out of the coverage gap. So it's more simplified now. This is new. It's called MPPP, 3 Ps, Medicare. I still have to look at it. Prescription Payment Plan. It's so new. That is, again, for some people is going to be a great advantage. What it does, it's not a savings program, so it just allows you to spread your costs of your medications over the course of the whole year. So let's just say somebody is at that $2,000 cap, and for some people that's still a lot of money. You can activate this plan with this payment option, and it'll spread those costs out. And it's pretty cool how it works. I'll talk a little bit about it here in a minute, a little more detail. And this prescription drug, so to your question, the phases have changed, so the donut hole or the coverage gap has been eliminated. And then there's what we call the plan finder. As ship counselors, we use the plan finder, but you can do it too. You can set up your own account, and I'll show you how to do that if you want to stick around. So this payment plan, do a little deeper dive. What that is, it's new, as I said, this year. Allows you to spread those costs out over the 12 months. Again, in the plan finder, you'll be able to click on, after you've put all your medications in, and see what that payment plan would look like. So instead of, you saw where, as an example, for prescription drugs, the deductible next year is going to be $590. If you go to the pharmacy on January 1st and you have an expensive medication, guess what? You have to pay that $590 right out of pocket before the plan kicks in. So what this does is it allows you to spread that out, and I can show you how to do that, how to see what the impact of that is. To enroll in this, you'll work with your prescription drug plan or the Medicare Advantage plan, whichever way you choose. You'll call them up and say, or the material you'll get, it will tell you how to enroll in that plan.
Is there interest, I assume?
Nope.
Interest free?
Yep.
That's interesting.
And again, you can call us if you have questions about that. The plan finder, I don't know if any of you get online and do all that or use, your mobile phones, but there's, again, I'll show you how to get on there if you don't have an account already. But these are some pretty neat improvements that we've seen as ship counselors that really help us help the client. So just to kind of, I know we talked about a lot of stuff, but I guess what I would say some key takeaways is to understand your enrollment periods and what the rules are. They can be different, particularly if you're new to it. For those of you that are already in it, we recommend that you review your plan, every year. Understand the different options that you have with Advantage plans versus original plans, original Medicare. That IRMA, if that applies to you, or if you know some folks that are in that, It can be a surprise for some folks. HSAs, so if you mentioned your wife was still working, if she's participating in a health care savings account, she needs to talk with her HR department and just see where that, because that can impact you. The short story is you can't be in an HSA and also get on Medicare. There's a time limit that you have to honor there. You need to just check out that prescription payment plan, get information on the financial assistance, and again, that's where you can call us up, or during these one-on-ones we would talk about that. And then for those of you that aren't quite, so you're leaving your employer plan, but you're not quite ready for Medicare, there's the marketplace, coverme.gov. It's a great website. And this organization, Consumers for Affordable Health Care, they're another nonprofit organization. So they do for the marketplace what we do for Medicare. They'll help you answer any questions. And that's their phone number there. I think we're going to arrange to send these slides to folks yeah, okay, good. And this is just some extra information that you'll have in that packet that they're going to send out. Yeah, so that's my story, and I'm sticking to it. So.